At the Boys and Girls Club's Roy Drachman Clubhouse on Tucson's south side, the kids are doing something unusual.
Right there. Ready? Let's go.
They're playing outside.
Signal!
A new bike club is luring them out of doors and into a new way of experiencing the world.
One of the big things when we first started working on the south side, I noticed that you didn't see a lot of kids riding bikes. And for me, it kind of breaks my heart because that's sort of the greatest part of childhood, right? Is you get that freedom and doing it with your family, and it's just a great activity and a great exercise.
As in many other communities she has studied, Monroy found a host of factors that were keeping people inside and limiting their opportunities to be healthy.
People in the past like to think of health as sort of this personal choice, but there are a lot of these structural barriers that keep you from being able to live a healthy lifestyle. Having access to food that's affordable and healthy and can be one of the barriers. The other thing is having safe places to walk, to ride bikes. If there are high rates of sort of crime in the area, that's going to make it more difficult. If you don't have the money to buy a bike for your kid, if you don't know how to fix your bike, and those are all things that sort of go beyond sort of that individual level and really has to do with access to resources. So it's what we refer to as the social determinants of health.
So when you're riding in a group, how do you have to ride?
Clubhouse director Rafael Duarte knows these social determinants well.
I'm from here, and I still get kids cussing me out, just hanging out at the park here. They broke our sign, I'm getting refixed. Not too long ago, there was a lady sitting at the park, or at the table right here. Some kids were throwing rocks at her and her daughter for no reason. And so it's like, I see why they don't ride. Now here we go, get ready.
Whether it's lack of resources and time or concerns about safety that keep them in, kids are spending less time outside. Studies suggest the average child has 25% less free play time today than in 1981 and only spends about half as much time outdoors. Adults are also spending less time in nature, and people of all ages are spending more and more time, an average of 8 hours a day, in front of screens. Scientists say that disconnect between people and the outdoors comes with a cost, because seeing and being in nature benefits both physical and mental health.
There's research at many levels that shows, first of all, that people prefer to look at nature views, that people have better moods when, for example, their apartments have views of a natural scene or of a grove of trees. And then there are similar kinds of studies done in hospital settings. So Roger Ulrich did a famous landmark study in people who were recovering from gallbladder surgery, who randomly were assigned to beds that had a view of a grove of trees or a brick wall. And the people who had a view of a grove of trees left hospital on average a day sooner, needed less pain medication, and had better moods, fewer negative nurses' notes than people who had a view of a brick wall.
Sternberg studies how access to nature affects health. She says being outside is best, especially for kids.
Obesity is a huge epidemic. It's a very big problem for all ages, and especially for children. With children sitting at their computers and basically having a sedentary lifestyle, it's very important to find ways to exercise, and especially exercise outdoors, because exercising outdoors has been shown to have greater health impact than exercising indoors.
But even when we can't be outside, seeing the outside can boost health. In one study, Sternberg compared people's fight or flight stress response when working in a building with beautiful views and plenty of sunlight, and when working in a dark, crowded space.
And we actually were able to measure on 2 separate physiological measures of the stress response a decrease in stress levels in people in the new, beautiful, light and airy space compared to the people in the old, dark space. And what we were able to show is that even if you're not aware of it, the physical environment does affect your moods and your health and your stress response. And in that study, we even found changes in one measure of the stress response, the heart rate variability, when they went home at night while they were asleep.
Researchers don't yet know what it is about nature that's so good for health. Sternberg and her colleagues are creating a cross-disciplinary institute on place and well-being to answer that question. They're starting with Tumamoc Hill, an important ecological and archaeological site on Tucson's west side that's popular with walkers and joggers. By gathering data from people who visit the hill, Sternberg hopes to tease apart just what it is about nature that draws people and seems to help them.
And one of the questions we want to ask is, what can we do? What skills can we give people, whether it's children or adults, all ages, all cultures? What skills can we give them to help them to get a greater benefit of being outdoors?
Martha Monroy teamed up with Tucson's Boys and Girls Clubs, Pima County, and a number of other partners to help provide those skills. They secured bikes and helmets and are teaching the children who frequent the Southside Clubhouse how to ride outside safely. Duarte says he's seen a significant change in just a few months.
They want to ride. They're asking all the time about when's the next class, when are we going to do something. They saw those bikes in the closet over there and they were wondering what they were for. They ask about it all the time now.
For Monroy, that kind of change is powerful. She says it can do more than benefit young bodies and minds. It can help heal the whole community.
We're going to do this more often to get you more confident, more lessons.
Taking back your community, saying we're not going to let this keep us from exercising and being healthy and having a healthy, integrated community, I think is really important.
Let's go. Good job.